If you have a heavy period, you may be wondering what else can you be doing to manage your symptoms besides going on birth control, because this is often the prescription that is given by doctors when you complain of heavy periods. Now, heavy periods is probably the most common reason why women go to see a gynecologist. And as somebody who has struggled with heavy periods since my period began, I know how frustrating and how problematic heavy periods can be. Let's take a closer look at heavy periods. So firstly, we'll start by defining heavy periods. So how do you know if your period is too heavy? Then we're going to go into some of the underlying causes of heavy bleeding, and then I'll go through some of the tests that are quite common to be done to try and get to the root cause of the problem, some of the treatments that are often given typically conventionally when it comes to prescription medications, etc. And then I'll go into a more holistic approach to heavy bleeding. So if you have a heavy period, then this video is just for you. So approximately 30% of women who are menstruating will struggle with heavy bleeding. And 2 out of 3 reasons why people get a hysterectomy is because of heavy periods. So this is a serious problem. Now, heavy periods, although they may be very common, they have somewhat been normalized. So if you just have heavy flow, you may be feeling like you just kind of have to deal with it, like it's just a normal part of your menstrual cycle. And the truth of the matter is that heavy bleeding and heavy periods is not something that you just have to live with. There are actually things that you can do to manage that bleeding. And probably the most important thing is to get to the root cause of why you have heavy bleeding in the first place, so that you can address the problem at its root to manage the heavy bleeding symptoms that you may be experiencing. So how do you know if your period is too heavy? Well, the medical term for heavy bleeding is menorrhagia. And typically speaking, either if you are bleeding for longer than a period of 7 days, or if your flow is very heavy, these are the 2 ways that we can determine whether you have menorrhagia. So typically speaking, a normal period should last anywhere between 2 to 7 days. So if you're bleeding for longer than a week, that is one sign that you have a heavy period. But then what about your flow? So some signs to look out for that your period flow is too heavy is if you are soaking your menstrual products within 1 to 2 hours. So if you have to quickly change your menstrual products every 1 to 2 hours, this is a sign that you are bleeding too much. Likewise, if you have to double up on your period products, so if you have to wear like a pad with a tampon to try and manage your flow, then this is a sign that your bleeding is too heavy. If you're losing more than 80 mils of blood per menstrual period. Now, this may be a little bit difficult to quantify, but if you're using a menstrual cup, it can be easier to measure how much blood you're losing. Another sign to look out for is if you are having large clots. So some clotting during your period can be considered normal, especially if you're having some small clots. This is usually a sign that blood has been pooling before it leaves through the vaginal canal. But if you're having clots that are more than 2.5 centimeters big, then this is definitely a sign that you are bleeding too heavily. If you have to wake up at night to change your period products, then this is also a sign that you are bleeding too much. And if your heavy flow is interfering with your daily activities, so if you have to avoid doing sports or social activities or going out because of your heavy bleeding, and especially if you know that you've had a few accidents, you've soiled yourself a few times, and that's making you nervous. In other words, your flow is interrupting your daily life, then this is a sign that you are bleeding too much. Another important thing to look out for is if you are having heavy bleeding persistently, then you may end up becoming anemic as a result. So iron deficiency anemia is most commonly due to heavy period bleeding. And some signs of iron deficiency are feeling weak, feeling lethargic and tired, getting short of breath. You may even have palpitations. And you may notice that your skin and your eyes and your nail beds are more pale than usual. These are all signs that you may be anemic, and possibly this may be due to iron deficiency anemia because of heavy bleeding. So if you have any of these symptoms, this is a sign that your period is way too heavy and that something needs to be done to address why that may be the case. Now that we know that you have menorrhagia or heavy periods, let's get into some of the reasons why you may be experiencing this symptom. So again, it's important to note that menorrhagia or heavy bleeding is not a disease. It's not a condition. It's a symptom. And it's a symptom of something underlying that is actually causing the heavy bleeding. So this is why it's super important to get into the root cause of why you're having the heavy period in the first place. Because if you don't know why this is happening, it becomes very difficult to manage and treat the underlying root cause. So some common reasons why you may be experiencing heavy periods is because of something going on in your uterus. So the uterus is the place where a baby would grow and develop. And ultimately, if you don't get pregnant during your menstrual cycle, then the lining of the uterus is going to shed as the period. So if there's something going on inside your uterus, then that may cause heavy period bleeding. Some examples of this include things like fibroids, which are non-cancerous growths or tumors that can develop anywhere in and around the uterus, and they can contribute to heavy bleeding. Some other examples are things like polyps, adenomyosis. So you may be familiar with a condition called endometriosis, where cells similar to the lining of the uterus will grow outside of the uterus. Adenomyosis is a similar thing happening, except instead of that tissue growing outside of the uterus, it starts to grow inside the actual muscle of the uterus itself. And this condition can cause heavy bleeding. If the lining of your uterus is too thick, also known as endometrial hyperplasia, this is another potential reason for heavy period bleeding. And then, of course, cancers of the uterus and cervix can also lead to heavy period bleeding. Staying within the uterus, infections can also produce heavy bleeding. So sexually transmitted infections like gonorrhea or chlamydia can cause inflammation inside the uterus, and this can lead to heavy bleeding. Likewise, a condition known as pelvic inflammatory disease, which is a general inflammation inside the pelvis, including the reproductive organs, can also lead to heavy period bleeding. Endometritis, which is inflammation of that lining of the uterus, can also be a reason why you may be having a heavy period. Then moving on to issues outside of the uterus. So if you have a hormone imbalance of some kind, this may result in heavy period bleeding. So commonly an imbalance between estrogen and progesterone can produce heavy bleeding, also known as estrogen dominance. Now, estrogen dominance can happen for a few different reasons. Either you are producing too much estrogen, or you are not clearing or detoxifying estrogen efficiently, or you're having xenoestrogens or foreign estrogens coming in from the environment that are acting like estrogen inside your body. On the other hand, you may not be producing sufficient amounts of progesterone to balance out the effects of estrogen. So this is a common reason why you may be having heavy period bleeding. Another common reason is if you are not ovulating. So during ovulation, that's when we produce progesterone. And so if you're not ovulating, then again, you're not producing enough progesterone to balance out the effect of estrogen. So a lack of ovulation during the menstrual cycle can lead to heavy bleeding, but it can also lead to prolonged bleeding. So bleeding beyond 7 days. Another common hormone imbalance that may produce heavy bleeding is polycystic ovarian syndrome, or PCOS. Now, typically PCOS can lead to a number of different hormone imbalances, can lead to high levels of insulin, high levels of androgens, can lead to an estrogen dominance as well. And overall, PCOS can also produce anovulation. In other words, no ovulation during the menstrual cycle. Now, bleeding in PCOS can vary. Some people will have very light bleeding and very infrequent periods with PCOS, but this may then be followed by very heavy bleeding. And that's because oftentimes in PCOS, the menstrual cycle is a lot more prolonged than 35 days. So you may be having less periods overall. So ultimately, those gaps in between your periods where you're not bleeding leads to thickening of the lining of the uterus, the endometrium, so that when you do have a period, you may be bleeding very heavily because of the thickened lining of the uterus, and also because if you haven't ovulated, you may also be bleeding for a prolonged period of time. Thyroid disorders may also produce heavy periods. This is another example of a hormone imbalance that may lead to heavy period bleeding. And then other health issues that are seemingly unrelated to the reproductive system may also produce heavy periods. This includes things like bleeding disorders. So if your blood is not clotting efficiently, either if you have low platelets or a deficiency in some of your clotting factors, this can lead to excess bleeding during the period. Likewise, liver disease can also play a role in heavy periods. So your liver is super important when it comes to producing your clotting factors, for example, but it's also where you are going to be detoxifying estrogen. And if you're not doing this efficiently, again, this can lead to estrogen dominance and heavy bleeding. Kidney disease can also contribute to heavy periods. Likewise, complications of pregnancy can also produce heavy bleeding. So whether it's a miscarriage or an ectopic pregnancy. But interestingly, iron deficiency can also produce heavy bleeding. Iron plays a critical role in your detoxification pathways. And if you're iron deficient, usually if you're bleeding heavily, that can lead to iron deficiency. But the opposite is also true. If you're iron deficient, then you may be more likely to be having heavy periods because of dysfunctional detoxification pathways in your liver. Also, some medications may be causing you to bleed more excessively during your period. So some examples are some antipsychotic and antidepressant medications may contribute to heavy bleeding. Likewise, medication that thins your blood, also known as anticoagulants, may also have this effect. Also, we all respond differently to hormones. So some hormonal contraception may actually cause you to bleed more heavily than usual. The non-hormonal copper IUD can also lead to heavy bleeding. So as you can see, there are multiple different root causes of heavy period bleeding. And because they're so different and because they're so diverse, there's no one-size-fits-all approach when it comes to managing heavy periods. And so hopefully you can see now why it's super important to get to the root of why you may be having heavy bleeding in the first place, so that you can take steps to address that root cause and therefore help to manage your heavy bleeding. So how do you get to the bottom of what may be causing heavy bleeding for you? Well, it would depend on what your doctor finds when they're taking a history from you. So, for example, if you have some symptoms that may be in keeping with a thyroid disorder, they may want to test your thyroid function. Or if you have symptoms that may be suggesting that you have polycystic ovarian syndrome, there may be different tests to do in order to diagnose that. So it really does depend on some of your symptoms that you're presenting with and maybe some of the things that your doctor finds on an examination. But generally speaking, it would be important to look at your hormone profile. Now, conventionally, you could ask your doctor to run some labs to check for your hormone profile. And you can get some good information from a lab test checking your hormone levels. But probably a more comprehensive test would be the Dutch test. This is a test that looks at your reproductive hormones. It also looks at your cortisol and your adrenal hormones, and it gives you an idea about what is going on in the menstrual cycle and where you may be experiencing some challenges. This test is not always easily accessible, and sometimes, so for example, I'm in South Africa, it can be very expensive to get a Dutch test done, and unfortunately medical aids do not pay for a Dutch test. So at the very least, just getting a hormone panel done by your GP is a good place to start. Your doctor can also order a glucose profile including an insulin level, and this can help to determine whether you may be experiencing insulin resistance or prediabetes, which again can contribute to heavy bleeding. In addition, a thyroid panel is super important. Now, when it comes to testing the thyroid, I know that most doctors will just do what's called a TSH, or thyroid stimulating hormone, and this is not enough to be able to look at the function of the thyroid gland. It's always best to do a full thyroid panel, including thyroid antibodies if they are indicated. So at the very least, a TSH, a T3 and a T4 are required to look at the function of the thyroid gland. A stool test is another option. Again, this is a more integrative test. Unfortunately, medical aids will not pay for this in South Africa, but a stool test can give us an idea about the health of your gut and about the microbiome, so all those bacteria and viruses that are inside your gut and the balance of those, because an imbalance in the bacteria inside your gut can impact your estrogen metabolism. So a stool test can be very helpful for determining if you do have an imbalance in your gut microbiome. Iron studies may also be helpful, again, because this can tell us, are you iron deficient, perhaps as a result of the heavy bleeding. But also remember that if you are iron deficient, replacing that iron is super important to improve heavy bleeding during your period as well. So an iron profile can be super valuable. And then generally speaking, checking for liver function, kidney function, these are super important as well. And then a complete blood count can tell us about whether you are anemic or not, but it can also tell us about your platelet count. Your platelets are those small cells in your blood that help you to clot, and if you have a deficiency in those platelets, then that could also potentially be a reason why you may be bleeding heavily. It's also important to check vitamin D levels. Low vitamin D can affect ovulation, and this is also a common thing that occurs in PCOS as well. So these are some of the tests that your doctor may want to do. Depending on your history and depending on if it makes sense to do so, they may also want to do a clotting profile to see if you have some kind of clotting disorder that is causing you to bleed heavily. So what are some of the common conventional treatments that are prescribed for a heavy period? So typically, if you are iron deficient, an iron supplement may be prescribed. And this is an easy thing that your doctor can do by looking at iron studies and looking at you clinically to see if you have any signs of anemia. Then replacing your iron is something pretty easy and straightforward to do. You may also be offered hormonal birth control, either in the combination birth control pills, or you may be offered an intrauterine device like the Mirena, for example. The Mirena provides synthetic progesterone, and this is also thought to help to balance the impact of excess estrogen. Birth control pills may also be offered to you if you have PCOS, because in PCOS, your androgens or your male type hormones are in excess. And so when you take the birth control pills, these are usually a combination of estrogen, synthetic estrogen, and progesterone. And so they help to balance out the effect of that excess testosterone. So birth control pills are commonly prescribed in PCOS for this reason. It is important to note that while birth control, whether it is the intrauterine device or whether it is the birth control pills, both of them are not getting to the root of the problem, and they may help to manage your symptoms, but unfortunately when you stop the birth control, you're going to be back at square one. Another common medication to be prescribed if you have heavy periods is non-steroidal anti-inflammatory medications. So these are things like ibuprofen or Voltaren. You may be familiar with some of these anti-inflammatories. And they're often prescribed in people who have heavy bleeding, but also for those who have period pain also associated with a heavy period. And then thyroid medications may be prescribed if you have a thyroid disorder. So these are the common medications that are prescribed to manage some of the symptoms of heavy bleeding, but also some of the underlying reasons why you may be bleeding in the first place. Then there are some procedures that may be helpful if you have heavy bleeding as well. For example, an operative hysteroscopy. So hysteroscopy is basically a test where a camera is inserted into the uterus to look and see if there are any signs that there's something inside the uterus causing heavy bleeding or causing your period problem. So for example, fibroids, polyps, and a thick lining of the uterus, inflammation of that lining of the uterus. You can see all of that if you have a hysteroscopy. So essentially what it would entail, you can have a hysteroscopy in your doctor's office. Sometimes you can go to theatre to have this procedure done, but typically speaking, a hysteroscopy will require your doctor to go in with a camera and have a look. So a hysteroscopy will enable your doctor to visually look inside the uterus and see if there's a reason why you may be experiencing heavy bleeding. Then if they do notice something that they can quickly fix, for example, if they see some polyps that can be removed, they can do so at the time of the hysteroscopy. So hysteroscopy is a great test because it enables you not only to make a diagnosis, but also to actually resolve the problem if you see something inside the uterus that can be addressed easily. An endometrial ablation is a surgical procedure where the lining of the uterus is either partially or completely removed. Now, this is an option for people who have extremely heavy bleeding, and perhaps you've tried everything to address the problem and there's nothing that is assisting you. An endometrial ablation can lead to either an absence of a period altogether, or it can lead to reducing the amount of period bleeding that you experience every cycle. However, this procedure will prevent you from having kids in the future. So it's not a procedure that is recommended for people who intend to get pregnant in the future. And then a hysterectomy is probably the most extreme procedure that is done for heavy bleeding. Like I said, 2/3 of the reason why people have a hysterectomy is because of heavy period bleeding. This is a major surgery and it entails the complete removal of the uterus. And after hysterectomy, of course, your period will stop and you also won't be able to have children in future. So let's get into a more integrative, more holistic approach to heavy bleeding. Now, it is important to note that when it comes to a more holistic approach, it does take time to implement these lifestyle changes, and it may also take time for you to start to see results. But ultimately, if you are in the camp of people who are looking for a more natural way to handle your period problems, and if you are done with birth control, and maybe if you don't want to undergo any surgical interventions to manage your heavy period, then this option is a good option for you. So first and foremost, it is important to note that food plays a major role in our menstrual cycle. Food is medicine, and ultimately you can actually modify your diet to include foods that may even help you to improve your heavy bleeding. So one of the things that's quite helpful for managing heavy periods and even for managing period pain is to follow an anti-inflammatory diet. Essentially what this would require is avoiding foods that can trigger inflammation. So these are usually very processed foods, foods that are packaged, foods that are highly refined, so that have had their fiber stripped out of them, sugary foods, foods that are fried and that are heavy in oils and trans fats. These are typically foods that can trigger inflammation and may make your bleeding worse. So an anti-inflammatory diet would include lots of whole foods. So whole grains, whole fruits and vegetables, all colors of the rainbow. And this would also include some anti-inflammatory fats. So healthy fat, especially omega-3 fatty acids, are super important for managing inflammation. So if you're eating a diet that is relatively clean of heavily processed refined foods and that is focused more on whole foods as well as including healthy fats, then this can be very helpful for managing heavy period bleeding. Also, consuming foods that are rich in iron, especially during your period, these are going to help to support you as your body's losing blood to replenish and replace your iron stores. In addition, consuming foods that are high in vitamin C will help you to absorb iron. It's also important to remember that moderate exercise can be a game changer for your overall health, but especially for your hormone health. Just remember, don't overdo it. So don't over exercise, because this can actually have the opposite effect. It can stress your body out, increase your cortisol level, and cause more hormone imbalance. But if you start to include moderate exercise into your lifestyle, and especially if you sync this up to the different phases of your menstrual cycle, then this can be really supportive and nourishing to your body. If you're looking for a guide for how to do this, as well as how to incorporate different foods at different points in your cycle to help to manage your hormones and regulate your period, then check out the 28-day Hormone Balance Reset guide. I'm going to link it in the description below. Then there are some supplements that may help you to relieve heavy period bleeding. In particular, Vitex Chaste Tree. This can be very helpful for increasing your progesterone, increasing your LH level, and helping to regulate your menstrual cycle, especially if you haven't been ovulating, and also if you've been having prolonged period bleeding. It's just important to note that in people with PCOS, using Vitex may actually increase your LH even more, and so it may not be the ideal supplement if you have PCOS. Then there are other herbal supplements that may be helpful. So ginger is a fantastic anti-inflammatory herb or spice or root. Basically, ginger is great for its anti-inflammatory and antioxidant properties, and it's pretty much as effective as common anti-inflammatory medications that you may be able to get over the counter. Incorporating ginger, whether it's in a ginger tea or incorporating ginger into your cooking, this can also help to reduce some of the pain, inflammation, and heaviness of the bleeding you may be experiencing during your period. And then 4 herbal supplements that you may find helpful for managing a heavy period are shepherd's purse, yarrow, dandelion, and red raspberry leaf. These can all be helpful for different reasons. They can help to tonify or strengthen the muscles of the uterus. They can also help to reduce heavy period flow. And dandelion in particular is supportive to your liver, which can help you to detoxify as well. So I definitely look into these 4 herbs if you're experiencing heavy period bleeding. Iron supplementation is also super important, but a lot of iron supplements can be constipating. So the iron supplement that I usually recommend is an iron bisglycinate. It's very well absorbed, very well tolerated, doesn't have some of those adverse effects on your gut, and can really help to increase your iron levels effectively. And finally, vitamin C is also super important, not only to help to absorb iron, but also to increase your progesterone level. So especially if you're having an ovulatory cycle, so if you're not ovulating, whether you have PCOS or whether you have a very long period, and even if you have a luteal phase defect, vitamin C can be helpful to naturally increase your progesterone level. And an important thing to kind of go along with that is stress management. If you are not ovulating, you need to prioritize managing your stress. Now, I know that stress is one of those things that we can never escape. We live in a stressful world, but prioritizing how you manage that stress in your body is going to be super important for bringing balance back into your progesterone level in particular. Remember, we said that if your progesterone is low relative to estrogen, then that can actually cause heavy period bleeding. So focusing on your stress management and your self-care are going to be super important, especially for those of you who are not ovulating. So I know that this was a lot to take in, but I hope that you found it helpful. And again, if you're looking for a guide to help you step by step along the way, explaining the menstrual cycle, diving into each phase of the menstrual cycle, and how you can support yourself using food, using movement, using herbs, and especially if you want some delicious recipes, you can check out the 28-day Hormone Balance Reset guide in the description below. Let me know if you found this helpful and if you have any questions, and feel free to share this video with somebody who you think may find it helpful too. And until next time, I'll see you in the next video. I'm Dr. Carmen. Take care of yourself. Bye-bye.